welcome back to my channel Dr. T. So in today's video I'll be talking about a very interesting topic, that is unexplored branches in NEET PG. So कुछ ब्रांचेस ऐसी हैं जिसका आपने नाम सुना होगा इंटर्नशिप में और एज अ NEET PG एस्पिरेंट, बट you don't know the extent of it, you don't know the potential it holds as a career option for you. So in this video I have interviewed my co-PGs from Tata Memorial Hospital and from KEM, जो ऐसी ब्रांचेस में है जिसमें लोगों को पता नहीं उन ब्रांचेस के बारे में, क्योंकि ये अभी अभी आई हैं, लाइक 10-15 ईयर्स पहले ये आई हैं, एंड द पोटेंशियल इट होल्ड्स, एंड जो टैबू है अमंग्स द पीपल कि रेडियो मेडिसिन ही सब कुछ होता है एंड बाकी ब्रांचेस नहीं होती है, एंड इफ यू टेक दीज ब्रांचेस योर लाइफ विल बी कॉम्प्रोमाइज्ड. So just to remove that taboo, I have interviewed my co-PGs and they have given their opinions as a JR1 and 3 months into the residency, और उन्होंने ये ब्रांच क्यों चूज करी एंड क्या होता है एक्चुअली इस ब्रांच में, so that you can decide it for yourself. And the point of making this video at this time and not later at the counseling time is because I have also been through the same phase कि NEET PG के 1-2 महीने पहले GTs में नंबर नहीं आ रहे, रैंक नहीं आ रही है, and the frustration, the disappointment and confidence ही कैसे धज्जियाँ उड़ती है, I have experienced it first hand, and that's why I am bringing this video to you just to tell कि रेडियो अगर आपकी 2000 रैंक नहीं आ रही है तो 6000 में you can get nuclear medicine, and these branches are similar to radiology only. So please don't lose hope, please अब डटे रहो, बिकॉज इन द एंड से वही काम आएगा कि कौन एंड वक्त तक हु डिडंट गिव अप, एंड यू शुडंट बी, विच होल्ड्स मोर स्किल एंड मोर पोटेंशियल, एंड द मोस्ट important thing is less saturated. Let's start interviewing them. So guys, let's meet Dr. Sumit. He's from Maharashtra, currently a nuclear medicine JR1. So Dr. Sumit, what is nuclear medicine and why did you choose this branch?
Nuclear medicine is a recently less explored path. In nuclear medicine, we have like a diagnostic modalities and therapeutic modalities. It is one of those rare branches that offers that, like a diagnostic and therapeutic modalities. So we call it as a theranostic branch. Like radio is a purely diagnostic branch, and medicine offers you both diagnostic and therapeutic branches, like varieties. In nuclear medicine, we have like the basic work of diagnostic modality in nuclear medicine is PET CT and a SPECT, or what we call as a gamma camera. Okay, in PET CT we use different radio labeled tracers to identify the metastasis in various cancers related to the body. And in SPECT or gamma camera, what we do is like we use the different radio tracers to like do various tests like HIDA scan, MUGA scan, MIBG and various other tests. In therapeutic part, like there are various therapies being developed for various cancers. As you know, the chemotherapeutic drugs are very toxic to the body, so there are like approaches being made to make the radio medicines. Like now what we knew earlier was TACE, transarterial chemoembolization of hepatocellular carcinoma. So recently there has been like development of TARE, what we call it as a transarterial radioembolization. Here we use yttrium-90 labeled radio labeled medicine to embolize that single loculated lesion in the liver. So that's why like, and this branch is less explored, and it offers you like to do some research and get published. Like, so I wanted to do some research and I wanted to go ahead with publishing my journals and articles, and that's why I took this branch.
Okay, now let's meet Dr. Abhishek. He is one of my co-PGs and a FMG student from Karnataka. So Dr. Abhishek, what is there in this branch anesthesia and why did you choose it?
Hi guys, myself Abhishek here. See, anesthesia is basically perioperative medicine, like where you look after the patient when he's under, general anesthesia. He's deep, like he's sedated completely, he's asleep, and you have to take care when the patient cannot tell you what is happening with him. Like you have to assess just from the monitor कि क्या हो रहा है. You have to anticipate things and you have to act on it. Like there's no one, the patient is not gonna get up and tell you that I'm getting pain here, or something is happening in my limb, something is happening in my head. So just you have the monitors here, and then all the variables, and then you have to see that and then act on it. And I took anesthesia basically because see, it's a instant gratification. Like there's a patient, you give anesthesia, he gets up without any fuss, you know, you give reversal, he comes back and he talks to you. It's instant gratification. You have done your job well, and then you are anticipating a complication and you are ready for it. If it happens, then you are ready for it and you're gonna act on it. If it doesn't happen, but you have that satisfaction that you were ready, and I know what should have been done if something had gone wrong. So that is instant gratification that we get in this branch. And in anesthesia, we have a lot of things. Like it's not just the just the OT. We have pain management, and we have critical care medicine where you look after the ICU, and then there is a lot of skill involved here. It's not just sitting there on a table and just looking at the monitor. It's so much more in this branch. Like during internship, we often misunderstand anesthesia is just sitting and then having a tea. In pain, the pain management is something which is very new. Like there are a lot of interventions involved. You give blocks, and there's wide range of skills that I was talking about. Is basically, even it can be as simple as putting an IV cannula to putting a double lumen tube, or doing a awake tracheal intubation, like where you are intubating a patient who is awake without giving him any sedation. You are intubating a patient. And then other skills are, you know, the regional blocks, ultrasound guided blocks that we have, and central line cannulations, and then these are just the mechanical works, but the actual skill is what we anticipate on the monitors. Like you have to know physiology. If you're someone who loves physiology and this is your branch, cannulation, these are mechanical things, anybody can do it. Even a sister or a nurse or even anyone who does it for a week can do it. But these things are something you develop over a period of time. And I'm very new in this branch, and I'm still a kid here. I'm a foreign medical graduate, and this message is especially for my fellow foreign medical graduates who are come from various countries. See, we are the same. We are afraid that we may not fit into the setup. We may not, you know, we are not as good as the Indian graduates. Yeah, there are few changes in how we learn things, but at the end of the day, we are taking care of a patient, and it's gonna be the same. The end result is the same. So you can do really well. Don't be under the impression that you come from a foreign and you can't do anything. You can do whatever Indian graduates can do. So be confident in yourself, and that's what I want to tell you guys.
Now let's meet Dr. Mihir. He is from Gujarat and a JR1 of radiation oncology or radiotherapy. So, Dr. Mihir, what is radiation oncology, commonly known as radiotherapy, and why did you choose this branch?
Hello everyone, my name is Mihir Solanki and I am from Gujarat. So first of all, radiation oncology, as Dr. Sumit said, like nuclear medicine, it is very unexplored branch in your UG times. So I came to know about the branch after my NEET PG results only. When I researched about this and I started liking the branch, because in my UG times there are many patients of the oncology whom we are referring out because we don't have the facilities in our college. So I'm feeling very bad for them. So I badly need to be in this business from the my UG times. That's why I take a radiation oncology. I use that opportunity to came in that oncology field. Okay. So basically in radiation oncology, what we do is it's like a non-invasive technique to treat the cancers. It's basically it's like evaluation wali branch hai. Okay. So what we do here is when the patient come to our OPD, first of all we do the clinical examination and all the reports and all the investigations like CT scan, PET scan and all the investigation we perform for the patient. Then we have that joint clinic where all the surgical oncologist, medical oncologist and radiation oncology team is there, which will decide the treatment plan of the patient. And if the patient is fit for the radiation oncology radiation treatment, we will take one CT scan of the patient, and then we will make a radiotherapy plan where we see that patients like target organ should receive the particular doses, and we have that surrounding organs which we called organs at risk. So we have to see that these organs don't get much of the radiation dose. So like after taking the planning scan, we will do the planning on that CT scan for the 2 to 3 weeks. Then patient will be treated on the different machines, like we have the telecobalt machine, and one linear accelerator is also there. So linear accelerator is the most advanced treatment in the radiation field. So in most of the government college in our India, the linear accelerator is not available till now, but the government also focusing on that part. So hopefully it will come in most of the medical colleges in the next 5 years. So that's like good part for you, that you can think about this branch. And till now you can do medical oncology after the radiation oncology also. So if you are interested in oncology field, I recommend you to get in that radiation oncology part. Okay, thank you.
Now let's meet Dr. Surangama. She's from UP and JR1 of Immunohematology Blood Transfusion Department. So Dr. Surangama, what is there in this branch IHBT and why did you choose it?
So basically, immunohematology is it has three different segregations: immunology, hematology, and transfusion medicine. The basic of the branch is that it's related to manufacturing of blood components, assessing the patient vitals, and then deciding which blood component to issue. Our work is not just this thing related to the blood bank, but we are also called in various other places. There we have to assess and suggest which blood component is required. Other than this, there are therapeutic procedures also happening. There are lesser therapeutic procedures in Tata compared to other colleges, but the therapeutic procedures include therapeutic plasma exchange, which most of us know about. Other things are cancer patients, the procedure which cancer patients usually undergo, that is CAR T cell therapy. It helps them fight cancer. And so that's the long and short of it. And why I chose the branch is that because first of all, work-life balance is great in the branch, and I was interested in hematology. Hematology is something that really interests me. And as far as the future prospects are concerned, this branch is, as I said, divided into 3 branches. So 3 kinds of fellowships can be done after the MD this thing. The fellowship which is most famous in this is about hematology. The hematology fellowship is very limited. It is only currently it is only present in 2 places, and there are other fellowships in immunology and blood banking, apheresis. So there are multiple fellowships, and that's how the scope of the branch progresses. And it is not just limited to the blood bank, but of course if someone's interested in blood banking, then they can stay limited to the blood bank.
And now for pathology, let's meet Dr. Yash Gangwani.
हेलो दोस्तों, मेरा नाम है डॉक्टर यश गंगवानी. आई एम पैथोलॉजी रेसिडेंट डॉक्टर एट द केम हॉस्पिटल मुंबई. आज डॉक्टर तमन्ना जी ने हमसे 2 सवाल पूछे. द फर्स्ट वन इज व्हाट इज देयर इन पैथोलॉजी ब्रांच. सो पैथोलॉजी का मतलब ही टू नो द कॉज ऑफ डिसीज है. सो डिसीज का कॉज क्या है, उसे डायग्नोज करना, ये हमारा काम रहता है. मोस्ट ऑफ जो काम रहता है वो अंडर माइक्रोस्कोप रहता है, एंड इसमें अलग अलग सब सेक्शंस भी आते हैं, लाइक हिमेटोलॉजी, हिस्टोपैथोलॉजी, साइटोलॉजी. So let's talk about the second question, that is why did I choose pathology as my PG or post graduation branch. सो इसको मैं 3 पॉइंट्स में बताऊंगा. द फर्स्ट वन इज दैट इज वर्क लाइफ बैलेंस. सो ये ब्रांच आपको प्रोवाइड करती है गुड वर्किंग आवर्स. लाइक सुबह 9 o'clock से शाम को 7 बजे तक आपका मोस्ट ऑफ काम खत्म हो जाता है अगर आपकी इमरजेंसी या नाइट कॉल्स नहीं रहेंगे तो. सो इसकी वजह से आपको वर्क एंड लाइफ दोनों के लिए अच्छा टाइम स्पेंड करने के लिए मिलता है. लेट्स गो टू द सेकेंड पॉइंट. सेकेंड पॉइंट, मुझे ऐसा लगता है कि ये ब्रांच में फ्यूचरिस्टिक ग्रोथ एंड अपॉर्चुनिटीज बहुत ज्यादा है. आज पूरा वर्ल्ड अर्ली डायग्नोसिस एंड अर्ली ट्रीटमेंट में भरोसा रखता है. कोविड का जो एरा था उसने यही प्रूव किया है. सो ये ब्रांच में उसकी वजह से बहुत ज्यादा अपॉर्चुनिटीज आगे बढ़ रही है. एंड थर्ड पॉइंट इज सुपर स्पेशलिटी एंड फेलोशिप्स. इसके बहुत ज्यादा ऑप्शन ये ब्रांच में आपको अवेलेबल है. सो मुझे ऐसा लगता है कि इट गिव्स एक्स्ट्रा एज टू यू. एंड अगर ऐसा कोई पर्सन है जिसे अच्छी जॉब अपॉर्चुनिटी चाहिए, अच्छे वर्किंग आवर्स चाहिए ना अच्छा पेमेंट चाहिए, तो आई पर्सनली थिंक ये ब्रांच आपको प्रोवाइड करती है. So thank you so much Dr. Tamanna for featuring me in this video. Thank you so much guys. See you soon. Bye bye.
I hope this video was informative to you and you got to know what actually these branches are. And if you found it informative and helpful, please like, share and subscribe. See you next time. Bye bye.